All right. Good morning. Welcome to a virtual ribbon cutting. This is the first. We've done many ribbon cuttings, during our time here at Ocala Health, especially over the course of the last 5 years. Today is no different. We continue to grow and expand here at Ocala Regional as well as West Marion across Ocala Health. We're glad to have you join us virtually today. This is an exciting day for us because we don't have just one ribbon cutting today. We actually have two ribbon cuttings today. So we're continuing to grow across both campuses, and we're really highlighting our cardiovascular services as well as the OR services here at West Marion. So today I'd like to thank Dr. Paul Urban for joining me today, as well as Dr. Afolabi, our EP physician, as well as Commissioner Michelle Stone, Kevin Sheely, as well as Mayor Gwynn here for the ribbon cutting today. One thing I did want to highlight, this was Gabe Bolero, was the CEO here at West Marion, was originally going to do the ribbon cutting today. Very fortunately, yesterday, actually, Gabe and his wife Jennifer welcomed their fourth, child at North Florida Regional Medical Center about 3 o'clock yesterday afternoon. Very proud to report that Isabel as well as Jennifer are doing fantastic up there. I know Gabe wanted to be here, but he rightfully chose, to be up in Gainesville today. Good choice, Gabe. Yeah. So, just one of the things, just want to continue to highlight, Ocala Health is part of HCA Healthcare, one of the nation's largest health systems, and we're continually dedicated to understanding the needs of our community and doing all we can to address those needs. As Marion County continues, to grow, and Kevin, is very proud to report and very proud to be a part of the growth of Marion County. Ocala Health has grown, really continuously over the course of the last 5 years. West Marion, obviously out here, was a 70-bed facility in 2014. Today, it's 186, beds, and we continue to really see kind of the growth and the development that's happening out here on the west side of I-75 in western Marion County. And this facility continues to grow, and we continue to grow kind of its services here at this community. So today we're very proud to really kind of introduce you guys to a brand new state-of-the-art 10-bed cardiac pre and post cath lab, as well as the addition of our second cath lab out here at West Marion facility. This represents a total investment of $27 million, adding 13,000 square feet of new space, to the West Marion campus. This year, the importance of access to healthcare has been on all of our minds, very obviously. We've never been more focused on health and the health of those we love. We encourage residents to continue to safety measures to stop the spread of COVID-19, and we also want to stress there's still other health concerns that require attention. Your health is a priority, and we stand ready to serve you and your family and provide you with a safe place to receive best-in-class care in your own community. Just before I hand this off, really wanted to highlight, and we're going to talk a little bit about it more, but cardiovascular care across Ocala Health is really a signature service. And as we think about foundational services for our community and really foundational services for Ocala Health, cardiovascular services really is a centerpiece, of that care. Dr. Urban has been in this community for 30 plus years, caring for this community and doing an outstanding job. Dr. Afolabi actually joined us about 3 years ago and has really brought best-in-class EP services, to Marion County. This investment continues to highlight the incredible care that they provide, for our community, and actually award-winning care, recently being recognized as a top 50 hospital in the United States by IBM Watson Fortune magazine. And this is a continued investment in best-in-class facilities and equipment so that our best-in-class physicians can provide that care for our community. So with that, I'll turn it over to Dr. Afolabi for a few remarks.
Thank you very much, Chad. Thank you very much, Ocala Regional Medical Center, for giving me the opportunity to be part of this amazing team, amazing hospital and community. When I joined Ocala Regional 3 years ago, I didn't know what to expect. There had been no electrophysiology or service for about a year before I joined. But I was very pleasantly surprised that their management had been able to keep and grow a team that would support me almost immediately. I saw that support. We were able to ramp up our services almost 150% within the first 6 months. We were nationally recognized within the HCA system for that ramp up in cardiovascular and electrophysiology care. For some of you at home, electrophysiology is a specialized branch of cardiovascular medicine, which involves the treatment of rhythm disorders. It is a fresh, newer specialty, very technologically advanced and heavy. And because of that, we rely a lot on the hospitals to support us both with service lines and the technological advances. The addition of this second lab here at West Marion Community Hospital, which is no longer a community hospital at this point, I must say, has been a very good addition to our service line. The newest and the best equipment has been installed and will be ready to go in a very short period of time. I'm excited to be part of this team, and I look at expansion on the west side of the community of the county, and as we continue to grow our main hospital electrophysiology department in the downtown area. Thank you very much.
Hi, I'm Dr. Paul Urban. I came to Ocala in 1989, and I opened up the cardiovascular program at then was called Marion Community Hospital. We had a modular thing that was brought in on a truck and a little cath lab and about 2 recovery beds, and there were actually 4 open heart beds sort of off to the side in the surgical ICU. And the amount of growth that has happened is just absolutely unbelievable. We now have 2 full-service HCA hospitals here where complete cardiovascular needs can be totally met. And it's really, really, really high quality, and I'm very proud to be a part of it. I could have retired a long time ago, but I don't want to because I'm excited to be a part of this. And I think I really want to express a great thank you to the community. I think now on the west side of town, you don't have to go, quote unquote, downtown to get absolutely quality, amazing cardiac care. And I want to really express a thanks to HCA for putting in all the resources, and also to Chad and Gabe, because they have been incredible leaders and they really have pushed this. And even the chief of HCA even came down here a couple weeks ago just to see what was going on here, and I hear that he was extremely pleased. So this is a great program. It's going to get better. There's growth on the west side, and I'm sure that HCA will keep up with it. And now we have everything you need, from having an EKG to having a heart attack right here, and it's top notch. And thank you all very much for all your support.
That was excellent. Thank you very much, Dr. Urban. I think that's it. It's great for them both to highlight, and it's great to have both Dr. Urban as well as Dr. Afalabi here. Dr. Urban really brought interventional cardiology to this community at Ocala Regional, and now really expanded it out here to West Marion. We started the cardiac cath program, interventional program in 2016 out here, started the STEMI program out here in 2016. He's been a leader and really the builder, of that. Dr. Afalabi represents the person who's really brought EP services, to Ocala Health. She brought it to the Ocala Regional Campus first, and is now really leading our efforts in bringing those same quality services to us out of the West Marion campus. It's incredibly exciting to be a part of kind of the continued growth and development of care on the western part of this town, and the medical staff and the leadership and partnership we have is incredibly important for that. With that, in addition to this, at this point in time, I'd also like to bring up Commissioner Michelle Stone from the Marion County Board of County Commissioners.
Thank you, Chad. Good morning, everyone, and I am so pleased to be here to see the expansion of West Marion Community Hospital. These new cardiovascular recovery and surgical suites really do indicate such a huge investment to the growing healthcare needs of Marion County, especially in the western portion of Marion County. On behalf of the Marion County Board of County Commissioners, I do again want to extend our best wishes for the future, and I also want to thank you for the huge investment. Ocala Health has invested, as Chad spoke earlier, $27 million for this 13,000 square foot project, which expands West Marion Community Hospital's surgical facility to 10 operating suites. Operating rooms. And we are very blessed to have such stellar healthcare here in Marion County. And the project that has been produced here only demonstrates their commitment to providing quality health care for all of the citizens in Marion County. So again, thank you for your investment, and we look forward to the future.
Very good. Thank you, Commissioner Stone. Mayor Gwynn? You've been out here before, once or twice, right?
Yeah. Now I'm going to take my glasses off. I can't see with this mask on. Up. So, well, one of the things I just wanted to say, and we're talking about the growth. I was on city council in December of '99, so I was privileged to sit in many council meetings and listen to all the planning that went on behind what you see here today. Many times we walked out of council meeting the next morning. The discussions were so long, and people were saying, well, I don't know if this will work. Is this the right location? What will it do to 200? 200 will fail. It'll never work. But you proved them wrong. It did work, and it worked in a great way. And not only because of the growth of this, I think Dr. Urban touched on this, because of this, everything you see around you worked. Heathborough, where Coles is, all the development that's gone on, all around you. It's just been a really important addition to not only the city, but the county as a whole. From a development standpoint, from a medical point, obviously the care that you receive here, which is obviously why you're here to serve the patients that you have, couldn't be any better. From Dr. Duke and all the different doctors and practices you have here, and your other groups you have around the city, and your emergency room on the east side of Ocala to serve those constituents. It's wonderful. You couldn't ask for anything any better. I've watched this hospital grow. I'm 66 years old, so this hospital was referred to as the little hospital on the other side of the street when Monroe was Monroe. So I've seen people like Chad, come through here over the years since I was a kid, growing up, and the job that you've done with this hospital is nothing short of amazing. And we look forward to the continued growth of this hospital and all the things you'll bring in addition to what you already have. So with that, I appreciate it. And Chad, thank you for your leadership and everything you've done, and all these doctors and everyone in this room and everyone out there for your leadership. I appreciate it. Thank you.
All right. Thank you, Mayor Gwen. All right. At this time, Kevin.
I get to talk first, then we cut the ribbon. So, it's become part of the rhythm at the CEP that every few months we do a groundbreaking at an Ocala Health facility, and then a few months later we're doing a ribbon cutting. Often those are very different facilities, and we're moving around, and we look forward to that. And COVID's made it a little bit different, but here we are, once again celebrating a ribbon cutting for another investment with Ocala Health. And, there's lots of things to celebrate today. We can celebrate this new facility. As been mentioned several times, we can celebrate this $27 million investment. Or over the last few years, $144 million investment in our community. And Commissioner and Mayor, that means $29 million in taxes. We like all those things. We can talk about 2,500 and more jobs that Ocala Health provides in our community. But I think the most important thing is something that Dr. Urban said. And that is, today, you don't need to leave the Ocala Metro to get the cardiac care you need. That you can stay in our community and get not just care, but the very best care. The care that you want for your family. And that really means that we're a better place. It also means that people who live around outside the Ocala metro are coming into our community to receive care. That makes us an even better place. We just finished a sales tax issue. We really like when they come in because they spend a few more dollars here. But it really goes to that idea that we're an incredible community to call home. That whatever your need is when it comes to healthcare, you can find that need met in our community because of Ocala Health in large part. So thank you all for this investment. Thank you for what you're doing to make our community healthier and safer. And we're excited now to help cut the ribbon.